Good evening. Yeah, I didn't see that.
Because this is the evening for you. Shall we start?
It's 11:30 in the night.
Yeah. That's why I can't say good night. Shall we start, ma'am?
Yeah, sure. Yeah. Definitely.
I'm Dr. Nanda Devi, Head Department of Biotechnology, RBVRR Women's College. On behalf of college, I welcome you all, students, faculty, and especially Dr. Vijaya Nima ma'am for accepting our invitation from your busy schedule. Thank you very much, ma'am. Before we start this session, let me give a brief introduction about ma'am. That brief introduction itself gives a lot of information. Dr. Vijaya is an American board certified pediatrician. She's practicing in New Jersey, USA, since more than 20 years. She's also an American board certified obesity medicine specialist also. And she has other interests apart from being a medico. She is interested and also teaches yoga, meditation, and is a certified member in it. With this brief introduction, I welcome you, ma'am, to proceed with your session on treatment, prevention, and immunization against this COVID-19 disease. What everyone should know about it. Thank you, ma'am. Over to you.
Thank you. Let me share my screen. Google Drive is requesting access to your account. Authorize. Okay. One second. I just have to. Okay. I'm going to minimize this slide. Oh, you can see the screen, right?
Yes, ma'am.
Yes, ma'am.
Okay, very good. So then it has come up. Okay, I'm going to talk. Good morning, everybody. I'm Dr. Nima, as I was introduced, and thank you for the introduction. So it'll be mainly on COVID vaccines, which I've done before for your college for another group, but I did add some extra information pertaining to management of COVID, so which I'll share in the later slides. First, I'll go with the basic information. Okay, so just as a statistics, I thought this was very interesting. So I just thought, in terms of vaccination, how many of, this is the data from yesterday, the updated data. It's unbelievable that only 3% of Indians are fully vaccinated. That means they got 2 doses, but at least 14% got 1 dose. I don't know if you all fall in that category over at your college, but it's unfortunate that it's other countries in the world are up to 30 to 50%, whereas India is only 3%. Very unfortunate in that sense. So I just wanted to share that data with you. This actually should have been somewhere in the last, but then coming to immunizations. So we are mainly interested in talking about COVID vaccines for tonight. As I said, I'll add on a little bit of information and other management plans of COVID too. So what is immunity? Immunity is a protection from an infectious disease. So if you are immune to a disease, you can be exposed to it even without being infected, like you've seen chickenpox, measles in India, right? So once you're exposed, you develop immunity, you don't get it again and again. So that's what is immunity. So for that, normally you can get an infection and you develop immunity. But then again, what is the other way to develop immunity? Is a vaccine. So what is a vaccine? It's a product. Vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, okay, protecting the person from that disease. Vaccines are usually either through the needle or through the mouth, as polio is through the mouth. And there are some that you spray through the nose also. Now they're making flu vaccine was through the nose. And recently they're working on getting COVID vaccine through the nose, especially one Russian company that made the Sputnik vaccine is also working on getting the nasal version of the COVID vaccine. What is vaccination? It's an art of introducing a vaccine into the body to produce immunity to a specific disease. What is immunization? There's a difference between that, right? Vaccine is how you introduce the vaccine into the body. Immunization is a process by which the body becomes protected against a disease through vaccination. And sometimes in some countries, they use this, another word for vaccination is inoculation. So that's what it is. And so what's an immune system? So we develop immunity. But what is an immune system? It's a body's defense against infections. So the immune system attacks germs and keeps us healthy. So as soon as it finds some foreign body in us, the body fights it out. So what are the parts of immune system? There are many parts, many cells and organs work together to protect the body. So white blood cells are also called leukocytes, play an important role in the immune system. Some of the white blood cells are also called as phagocytes. They chew up the invading organism, as you see in the picture over there. So you see the organism and it's engulfing and it eats up the invading organism. The others are called lymphocytes. They help body remember the invaders and destroy them. This is what is mainstay for immunity is the lymphocytes. How body develops immunity is through the lymphocytes. There are two types of lymphocytes. One is B lymphocyte and T lymphocytes, as you see in the, I skipped the neutrophil because neutrophils are, again, most of us know when you do a blood work, right? What you check is the neutrophils, WBC count neutrophils. If the neutrophils are high, that means it's fighting an infection. So it's the body's defense mechanism against an organism, especially bacteria. Lymphocytes are mainly for viruses. If, that's how when I get a lab and I have to review, that's how I review. What's more, neutrophils or lymphocytes? Neutrophils, okay, my brain says, okay, it's more for bacteria. Lymphocytes, oh, it's more viral. So, but among the lymphocytes, there are two kinds of lymphocytes, B lymphocytes and T lymphocytes. Lymphocytes start out in the bone marrow. Where are they produced? In the bone marrow. And either they stay there and mature into B cells or go into the thymus gland. Thymus gland is by the sternum here to mature into T cells. B lymphocytes are like body's military intelligence system. They find their targets and send defenses to lock into them. T cells are like soldiers. They destroy the invaders that the intelligence system finds. So once the organism invaded, B cells come, it it produces its own antibodies. Then to protect the antibodies, you need the helper cells. The T cells are also called as the helper cells. So they help the B lymphocytes do its function. And now, so this is a basic overview of how the immune system works. So when a body senses foreign substance called the antigen, the immune system works to recognize the antigen and get rid of them. B lymphocytes are triggered to make antibodies, also called as immune globulins. So you've heard this during COVID season. Oh, I've developed immunity. What are they checking? They're checking for immune globulins, especially the two types, IgG and IgM. So that's what, it's nothing but B lymphocytes producing antibodies. What happens, these are proteins actually. The lymphocytes are nothing but proteins. They lock the specific antigens. After they are made, antibodies usually stay in our bodies in case we have to fight the same germ again. That's why someone who gets sick with the disease like chickenpox won't get sick from it again and again, because the body already remembers that you had the infection and body developed antibodies. And as soon as an organism hits the body, these antibodies are ready to fight the infection. Next slide. See, although antibodies can recognize an antigen and lock into it, they cannot destroy without a help. So what is the help? The T lymphocytes produce help. That's why they are also called as helper cells, okay? Or killers. They're also called as killer cells, actually. So what do antibodies do? It can neutralize toxins produced by different organisms, activate a group of proteins called complement that are part of the immune system. Complement helps kill bacteria, viruses, or infected cells. There are certain diseases that we check complement levels. Not all diseases you check complement levels, but certain diseases you do check, especially that involves immunity, like somebody has rheumatoid arthritis, or other kind of immune problems, or even HIV virus. We check complements. Very significant for them. So these specialized cells and parts of immune system offer the body protection against the disease. This protection is called immunity. And there are three types of immunity: innate, adaptive, and passive. So innate is everyone is born with an innate immunity. It's a type of a general protection, like skin. So it acts as a barrier and it blocks germs. As soon as you skin senses something foreign body, it just engulfs it with a release of our body defense mechanisms. Adaptive is either the disease itself causing, giving immunity, or the vaccines. So these are adaptive immunities. Either the disease or the vaccines, both develop immunity. Passive is when, for example, a child, as soon as the child is born, the baby does not develop immunity. But where is it getting from? From the mother. The mother has passively transferred immunity to the baby. That's why generally babies don't get sick till 6 months of age, because mother's immunity protects them for 6 months. That is passive immunity. Now coming to COVID vaccine. Prior to COVID pandemic, there was an established body of knowledge about the structure and function of coronaviruses. From where there was another thing called SARS, if you remember, a few years ago. So that was also caused by coronavirus. It was mainly in the Middle East. So that's why it's called Middle East Respiratory Syndrome. It had similar symptoms like COVID only. But again, it did affect the lungs. People have died there in Middle Eastern countries, but it didn't become a pandemic as COVID. It was more of an epidemic. On Jan 10, 2020, COVID vaccine was produced, and it's again intended against the SARS-CoV-2 that causes the respiratory syndrome. Okay, and it's a novel virus. Novel means it's newly diagnosed. COVID-19 is a novel virus. See, from where I learned is GISAID is a central firm that usually gives the formula of the vaccine or the genetic sequence of the virus that's causing this. Based on that only, any pharmaceutical company or any company that's doing vaccines develop the vaccine. So this is the center where the formula is given all over the world. And right now, after phase 3 trials, most of them put their vaccine into the market, which showed approximately 95% efficacy, most vaccines. There are types of vaccines. There are 2 RNA vaccines, which are mainly in US here, the Pfizer and Moderna. And 5 conventional inactivated vaccines, that is, you inactivate the virus that's actually causing. Covaxin comes into that category. Okay, and then there are other vaccines produced by different countries. And 5 viral vector vaccines. Viral vector is like you simulate a virus, like they take another virus. In COVID cases, they took an adenovirus and they added spikes to it, simulating the coronavirus. So that's what is viral vector vaccines. Sputnik belongs to that. Covishield belongs to that. And the one in US, Johnson & Johnson, is of the same category. The other 2 that are in study are 2 protein subunit vaccines, Epivac Corona and RBD dimer. Even I don't know much about it, but I've heard these are also very efficacious if it comes into the market or if they pass through the trial phases. There's a list of how many companies are doing, how many are, as of March 2021, 308 vaccine candidates are in various stages of development, with 73 in clinical research and 24 in phase 1 trials and 33 in phase 2 trials. 16 are in phase 3 development, just as a knowledge. Not just for knowledge purposes, I gave you this. Also, this slide includes different vaccines all over the world and what are being used right now and what frequency they are being used. Not a very clear slide, but if we can enlarge, maybe you can see it. So coming to our Covaxin, our Indian company Bharat Biotech makes the Covaxin, and it's been approved on Jan 3rd for emergency use, and it has efficacy of 78%. So this is an inactivated virus, right? So it works by teaching the immune system to make antibodies. Did I miss any slide? Okay. Against SARS-CoV-2 coronavirus, the antibodies attached to the viral proteins, such as the so-called spike proteins that stud its surface. To create Covaxin, Bharat Biotech used a sample of coronavirus isolated by India's National Institute of Virology. They got the specimen over there. What did they do? So, see, if you introduce like that itself, the coronavirus will infect a person, right? Or even the test phase, right? So what do? They use a chemical to inactivate the virus. The virus can no longer replicate. Virus, if only replicates, is dangerous. If it's a dead virus, it's not dangerous. So what they did, they made them inactivated. It's not like completely dead, but it's inactivated by a chemical called beta-propiolactin. The compound disabled the coronaviruses by bonding to their genes. The inactivated virus can no longer replicate, but their proteins, including spike, remain intact. So these are the spike proteins that remain intact. Excuse me. The researchers then drew off the inactivated virus and mixed them with tiny amount of aluminum-based compound called an adjuvant. What do the adjuvants do? They stimulate the immune system to boost its response to a vaccine. what was the previous vaccine that used? The polio vaccine, the rabies, the hepatitis A, all these vaccines are inactivated vaccines. Next, because the coronavirus is dead, it can be injected into the arm without causing the disease. So once the inactivated viruses are swallowed up by the immune cell, called an antigen presenting cell, the antigen presenting cell tears the COVID virus apart and displays some of its fragments, as you see in the picture on its surface. And so-called helper T cells may detect the fragment. If the fragment fits into one of the surface proteins, as it did in the picture, T cells become activated here and helps recruit their immune cells to respond to the vaccine. And then what happens? The B cell comes into play here. The B cells have surface proteins in a huge variety of shapes, and a few might have the right shape to latch onto the coronavirus. When a B cell locks on, it can pull part of or all of the virus inside and present coronavirus fragments on its surface. A helper T cell activated against the coronavirus can latch onto the same fragment. When that happens, B cells get activated. So T cells are helping the B cells to produce more antibodies. It proliferates and pours out antibodies that have the same shape as its surface proteins. Now, once vaccinated, what happens? Co-vaccine, the immune system responds to an infection of live coronaviruses. B cells produces antibodies that stick to the invaders, right? So this is when the actual virus comes in. So what happens after the vaccination? Suppose you came in contact. B cells produce antibodies that stick to the invaders. Antibodies that target the spike protein can prevent the virus from entering the cells. So it's like a guard around. It's not letting the virus go inside the cell. Other kinds of antibodies may block the viruses by other means. Now, coming to Covishield, mechanism of action will be almost similar, but here, as I said, it's an adenovirus. It's made from it's a virus from chimpanzee. Okay. So what did they do? It's usually, imagine a round object, just like a ball. It has no spikes, so it has to simulate, right? So they added spikes to the adenovirus vaccine. And you can read in that's the strain that's the AZD1222 is the one that they're using. And this is produced by Serum Institute of India. And its efficacy is about 76%. 78 for Covaxin, 76 for this. Although it's not FDA approved, but it's all these vaccines are for emergency use only. Here, little different in mechanism of action. As I said, the researchers added the gene of the coronavirus spike protein to another virus called adenovirus. Adenoviruses are common viruses that typically causes cold or flu. The Oxford AstraZeneca team that made this vaccine used a modified version of chimpanzee adenovirus known as the one that you read, CHEDOX1. It can enter cells, but it cannot replicate because it's an adenovirus. It's not the real coronavirus, so it cannot replicate. Wait, find this. Where am I? Oh, yeah, sorry. So it cannot replicate. So the AstraZeneca vaccine for COVID-19 is more rugged than the mRNA. mRNA vaccines, what happens is they're very fragile. Whereas I'll tell you a little bit more about mRNA vaccines later. And these are produced by US companies Pfizer and Moderna. But DNA is not as fragile as RNA. So they don't need to be refrigerated, whereas mRNAs have to be refrigerated at freezing temperatures. Are not fragile as RNA, and the adenovirus tough protein coat helps protect the genetic material inside. Why is that important? Because the adenovirus genetic material has to be protected to produce immunity, right? As a result, Oxford vaccine doesn't have to stay frozen. Just because I'll go through a little bit on the other vaccine. That's why I had to tell this. After the vaccine is injected into a person's arm, the adenovirus bump on the cell and latch onto proteins of its surface. The cells engulf the virus into a bubble, as you see that, and pulls it inside. Once inside, the adenovirus escapes from the bubble, it's coming out, and travels to the nucleus, okay? The chamber where the cell's DNA is stored. The adenovirus pushes its DNA into the nucleus. That's why sometimes this vaccine is not still recommended in pregnant women or breastfeeding moms, because I don't know. I mean, they say it won't affect anything, but to me, I'm a little skeptical because it does change the DNA. The adenovirus is engineered so it can make copies of itself, but the gene for the coronavirus spike protein can be read by the cell and copied into a molecule called mRNA. So next, so now that when the mRNA leaves the nucleus, the cell's molecules read its sequence and begin assembling the spike proteins. Some of the spike proteins produced by the cell form spikes that migrate to the surface and stick out at the tips. The vaccinated cells also break up some of the proteins into fragments, which they present on their surface, okay? Like this. These protruding spikes and spike protein fragments can be recognized by the immune system. The adenovirus also provokes the immune system by switching on the cell's alarm systems. The cell sends out warning signals to activate immunity, activate immune cells nearby. By raising this alarm, the vaccine causes the immune system to react more strongly to the spike protein. Again, as soon as the virus enters the body, when the vaccinated cell dies, the debris contains spike proteins and protein fragments that can be taken up by a type of immune cell and an antigen presenting cell. Same as that, it's attacking. The cell presents fragments of the spike protein on its surface. When the other cells called helper T cells detect these fragments, the helper T cells can raise the alarm and help marshal other immune cells to fight the infection. Same way, again, as soon as the spikes are the antibodies, right? As soon as the foreign body comes, which is the virus, they start to produce antibodies. So similarly, like the other vaccine is Covaxin. And so on other immune cells called B cells may bump into the coronavirus spikes on the surface of vaccinated cells or free-floating spike protein fragments. A few of the B cells may be able to lock onto the spike proteins. If these B cells are activated by helper T cells, they will start to proliferate and pour out the antibodies that target the spike protein. The antibodies can latch onto the coronavirus spikes, mark the virus for destruction, and prevent infection by blocking the spikes from attaching other cells as before. Then killing the infected cells. The antigen presenting cells can activate another immune cell called a killer T cell to seek out and destroy another coronavirus. Did I repeat the slide? I guess I repeated the slide. Sorry. That's a repeat slide. Now, that is the two main vaccines that are still in use in India. Sputnik is also on the same lines as Oxford AstraZeneca vaccine. The only difference for that is the Sputnik vaccine, the adenovirus is the human adenovirus, whereas the Covishield is the chimpanzee adenovirus. The Sputnik vaccine is the human adenovirus, but again, the whole mechanism is the same. Pfizer or Moderna, I didn't mention much about Moderna, but Pfizer is, you don't need all these details. I don't know why this came up. A Pfizer vaccine is an mRNA vaccine, actually. So vaccine is based on virus genetic instructions for building the spike protein. mRNA, what's an mRNA? The vaccine uses mRNA, a genetic material that our cells read to make proteins. The molecule called mRNA for short is fragile and would be chopped to pieces by our natural enzymes if they were injected directly into the body. That's why they made DNA vaccine from Covishield because of the temperatures. In India, it's hard to maintain freezing temperatures. To protect their vaccine, Pfizer and biotech wrapped the mRNA in oily bubbles made up of lipid nanoparticles. Because of their fragility, the mRNA molecules will quickly fall apart at room temperature. Pfizer is building, it has built actually several containers with dry ice that stores temperatures up to -94. But recently they've made a progress, and now Pfizer is also stored at -2 to -8 degrees centigrade. I think you have seen the same mechanism as in Covishield, right? Because that also transforms into mRNA and spike proteins are formed and they go to the surface of the molecule. Same thing happens here. After injection, the vaccine particles bump into cells and fuse to them, releasing mRNA. The cell's molecules read its sequence and build spike proteins. The mRNA from the vaccine is eventually destroyed by the cells, leaving no permanent trace. Some of the spike proteins form spikes that migrate to the surface of the cell and stick out their tips. The vaccinated cells also break up some of the proteins into fragments, which they present on the surface. The protruding spikes and spike protein fragments can be recognized by immune system. Same thing. If you remember, it's the same thing as before, as we have done in Covishield vaccine. So let's go to some. That's how the vaccine works. Moderna is also the same. The efficacy of Pfizer is 95%, whereas Moderna is exactly the same mechanism of action as Pfizer. It's also an mRNA vaccine, but efficacy is about 94%. Okay, this is the same way the mechanism. Slides have been repeated. I asked my daughter to delete. She forgot to delete some of them. Sorry. So there is another vaccine, J&J vaccine. It's also it's like our Covishield vaccine. It's from inactivated virus. Okay, it's also from adenovirus actually. So. It's the same thing. The mechanism is the same. I just wanted to mention there's another vaccine in US that we use is Johnson & Johnson. Some differences. These are the latest usages. Covaxin, if you apply it in a phase 3 trial with Covaxin, it has an effect of 78 to 100%. This is the latest information as of 2 days ago. Okay, if you use this, it should be COVID injection, the effect is 70 to 90%. You see the efficacy has increased in both. These injections are applied only to people above 18 years of age. You see Covishield is now 12 years and above. So that's the difference. This has been approved for 12 years and above, I think 2 days ago. And again, both the injections should be taken with help of, with the advice of a doctor. And the injection of Covaxin is, the second dose is 4 to 6 weeks apart. And whereas Covishield, 4 to 8 weeks apart. But I guess because of lack of vaccine, they've done it for 12 weeks. Ideally, 8 weeks. So it's a pictorial view of the vaccines and their efficacy. You can go through that. And these are some of the, it's a slide, it's a picture showing who shouldn't take the shots. So Covaxin, anybody, or Covishield, anybody with history of allergies, if they have fever on that day, any bleeding disorders, and if they've received another COVID-19 vaccine, and any serious health issues detected by vaccine supervisor. Okay. And same thing holds for both. And whereas right now, Covishield, Covaxin is only for 18 and above, Covishield 12 and above. And pregnant women, again, should be avoiding, but they are okay with Covishield. But again, I would use that with caution in pregnant and breastfeeding the females. So that's the difference. And these are some of the vaccine side effects that you can expect. It's a slide that shows the side effects, almost pretty much the same. Although the symptoms are more with Covishield in terms of tenderness, pain, warmth, redness, itching, swelling, and bruising, where the vaccine is given. Not much with Covaxin, I believe. I don't know. That's what the information shows. But again, with Covishield, it's much more painful. You can get headaches, you can get fevers, joint pain, muscle aches, vomiting, flu-like illness, abdominal pain, lymph nodes. If you're vaccinated, this I've seen, it's some people may not recognize, but if your vaccine is given on the arm, you may feel your lymph nodes swell up underarm or by the side of your neck. You'll see like tiny bumps on the neck or in the axilla if you're taking in the arm. So not much seen with Covaxin, but more with Covishield. And again, rashes can be seen where vaccines are given. Some people faint, so that's also there, but they recover. And this is the management algorithm. This is a beautiful one. This is from ICMR from India. If you click on the link, right, it will take you to a bigger screen and you can see it's very well informed what to do in mild case, moderate case, and severe case. So mild case where you have just regular cough and cold symptoms, but no shortness of breath. You don't have any difficulty breathing, or if you check your oxygen level, it's normal. So that's a mild case. What do you do in mild cases? Of course, home isolation for any COVID case, right? Which is mild. And what you must do, social distancing, indoor mask, use strict hand hygiene, and symptomatic management with fever. You treat fever with antipyretics, use cough medications, multivitamins, and drink lots of fluids. Stay in contact with treating physician who, if you have a doctor, I know most of you don't have a doctor there, but again, you can have your own guidelines, getting information, or somebody that you can speak to, monitor temperature and oxygen saturation. It's better to have the pulse oximeter to check your oxygenation. But you should go to a hospital or call somebody that if you have any difficulty breathing or high fevers, cough, particularly if the symptoms are lasting for more than 5 days. Here, sometimes you see may do, right? So I have not seen that it has been very much helpful, but Ivermectin is a medication that's available in India, but it should be avoided in pregnant and breastfeeding moms. Okay, and the hydrochloroquine, earlier during the early phase of the disease, it was used widely, the hydrochloroquine, but I don't see anybody using now, but again, it's recommended. And inhaled steroid, that will help open up the lungs because it produces inflammation in the lungs, right? So budesonide is a steroid that will open up the lungs. So that can be used, okay? So it may do. The medication wise, most of the time it's symptomatic treatment. You're only using fever medication. Other than that, ivermectin, hydrochloroquine, and inhaled steroids. That is something that you can use at home. Moderate disease, anyone with respiratory rate, very important. What is our normal respiratory rate? Is 12 to 14 per minute. So you breathe at 12 breaths per minute only, if you observe yourself. If it is more than 24, then they're not holding, like they're short of breath. They do have difficulty breathing. And also their oxygen level between 90 and 93 on room air, not with oxygen, but on room air. Then here you have to send the patient to the hospital, but can be not in ICU, but in a regular floor, regular ward, where you can supplement oxygen to maintain the oxygenation above 95. And you can put a mask. It's a non-rebreather mask. That's what they call that. Sometimes you're just supplying the oxygen. That's all, a high flow oxygen. And then here, this is the stage. Like you see, after almost a week, if you're still symptomatic, then you give steroids. Methylprednisolone is a steroid. Most of you have heard steroids. That's what it is. Dexamethasone or methylprednisolone are widely used in India. They can be given through injection or by mouth. But here, because at this stage, most patients are at risk of strokes, right? So then what do? You have to add something that prevents clots in the blood. Okay, so heparin is the medication that you use to prevent clots in the blood. And of course, you have to monitor the patient continuously. How is he breathing? And his like if he needs any fluids, then you have to pump it through the IV. Here, usually what I've seen is, although the ICMR does not, it's using its caution recommending CT or chest X-ray, but most hospitals end up doing CT and chest X-ray anyway in this stage. And the labs, most important labs are CRP and D-dimer. D-dimer, why? Well, you must have heard of D-dimer. When D-dimer is elevated, that means they are at risk for clots in the body. And IL-6 levels, a lot of them do. It is of value when they are in management. Like you can gauge if IL-6 levels are 4,000 and you're treating and it comes down to 2,000, you know that they're going in positive direction. Okay. Doesn't have value in diagnosis, but have value in prognosis. Okay. And next, severe disease, anything above 30 or even 40. Right now, people even observe in the ward up to 40 respiratory rate. And then oxygen, room air, 80s are still on the ward, as far as I know. Anything below 80, then they are taking them to ICU. But technically, anything below 90 should be in ICU. And here you use a nasal cannula or a mask and see if you can do. If not, you have to intubate, putting the tube down the throat and support with mechanical ventilation. This is the stage. And again, you have to, the medications that you use are methylprednisolone, the steroids. Again, you put them on anticoagulants and lots of fluids. And if sometimes they may get secondary infections, so you have to use antibiotics at this stage. Here, you definitely get a chest CT. And based on that, you can use other medications like remdesivir and tocilizumab. Okay. So actually, at this stage only, you should use remdesivir, but I see a lot of, in moderate in the disease itself, a lot of them are using remdesivir. Really not very helpful. But in ICU, if they are in ICU, that's where it's more beneficial. Again, it's recommended, but in reality, this is based on how most people responded. But nothing is written in stone. These things can change. And as you see, high risk of severe disease or mortality. People die if they're over 60 years, if they have cardiovascular disease, hypertension, coronary artery disease, diabetes, and other immune problems like cancer or other things, and chronic lung disease, liver diseases, or anything to do like strokes, like paralysis. And also one more thing I've seen a lot is obesity. Anybody that's really obese have had high mortality. Okay. Then hold on, how do I go back? Wait. Okay, so now where was I? Here, right? So see, this is another, I just thought this was an interesting one. You can go through it. I'm not going to go through in detail because I wanted to touch base on that ICMR guidelines. So that here, there is another link that I sent. It's a 300-page link. If anybody has time and want to review, it's in detail, the management, latest up to date. So up to, I think, late May, the information is there, but it's too detailed. But anybody is interested can check the link out. Lately, of interest is a topic is mucormycosis, right? What's called as a black fungus. It's a dangerous disease, of course. How is it caused? It's caused by a group of molds. It's nothing but a fungus called mucormycosis. Where does it affect? Your sinuses, your lungs, your skin, and your brain. So how do they go? You inhale these spores and come into contact with them in things like soil, rotting, produced bread, or compost piles, right? So it's all over in India. That's why I guess it's on the rise. So who is at risk? The infection can happen to anyone at any age. As we all know, we all come in contact with fungus there, but not all the time you get sick. Only with weakened immune system, when you had hit yourself with COVID virus, I guess that's when your immunity is down. So you're at risk then, especially in diabetics, okay, which is uncontrolled. Controlled diabetics that maintain blood sugars, it's been okay. And HIV, AIDS, cancer, organ transplant, stem transplants, neutropenia, where the white blood cell is low, so the body is not fighting any infection if it is low. And people who have been using steroids for long term, especially with COVID, they've been, it's normally supposed to be given after 5 to 7 days, but they're using even in the beginning. So it's all contributing to that. In injected drug use, high levels of iron in your body, bad health from not eating well, uneven levels of acid in your body, and premature birth. This is more for kids. How do you get it? It's more likely you have a skin injury like a burn, cut, or a wound, and cases have been reported in people with COVID-19. So that's take home. So they must have had something. The point of entry is through the skin most of the time, but it is not contagious. Okay. Treatment, you should start treatment as soon as you diagnose it. There are 3 medications that are being used: amphotericin B, isavuconazole, and posaconazole. That's why they are in shortage for all these 3 medications right now. Right now, you must have seen something called white fungus also, right? The fungus caused, this is the regular fungus. Actually, it shouldn't be as severe as black fungus. Black fungus is only the severe form. This one is caused by regular candida, like the yeast infection. Most of us have it, especially women and children, right? They do get this, but I don't know why they say it's more dangerous, but studies are being done on that. But the use of this is unsanitary use of oxygen cylinders and overuse of steroids is the main reason why this white fungus is coming up. Okay, and also using tap water in the humidifier attached to an oxygen cylinder, okay, rather than a sterile water. That's what is also contributing to white fungus. Again, treatment is antifungals as soon as you diagnose it. Now, myths and facts around COVID-19 vaccine. Interesting topic, right? Taking the vaccine can cause one to get the virus. What's the answer? The answer is no. Covaxin uses both of these. Covaxin is using inactivated virus, and Covishield is using the spike protein of COVID-19 virus from chimpanzee adenovirus, right? So these both are incapable of producing any active disease. Okay? But they are doing some studies that are linking to vaccine, but I don't know, it's not proven yet. So until it's proven, they are not causing. The vaccine does not cause the virus. You don't require the vaccine if you have already gotten and recovered from the virus. In reality, no. If in reality, but for COVID, they are saying it differently. So the immunity, because it's not a very well-known virus. So it has, after a few years only, we will really know whether you really need vaccine or not. But until then, the guidelines are to vaccinate yourself 60 to 90 days after you get the COVID-19 infection. There is no need to wear a mask and follow the precautions after getting the vaccine. You know the answer for that. No, you need to wear a mask. So I guess that's how the second wave pretty much came in India. So mask is a must, and double mask, especially if you're going to crowded areas. If you have the luxury of staying home, stay home, and avoid social gatherings and wash hands frequently. The next one is the vaccines might be unsafe since they are developed so quickly. The answer is no, because they've done global research on this and they've found it to be safe. The only thing they did is they combined two phases at one time and to accelerate the process. So that's what they did. But only time will tell the real answer for that. Pregnant or breastfeeding women cannot be vaccinated. As of now, yes, as of now, yes, in India. Whereas here we are using not the DNA vaccine, right? We are using the mRNA vaccine here. So in US, it's being given, but in India, it's a DNA. So the answer is no. This vaccine is not advisable for during menstrual cycles as immunity is low. No, that's not true. So you can still give vaccine during menstrual cycles in females. Does it cause infertility or miscarriage? The answer is no. But anyway, in India, they're not even giving to pregnant women. So that question of infertility or miscarriage does not come into play. Do's and don'ts. So needless to say, wearing a mask, social distancing, and following COVID etiquette at the vaccination center is a must when you go get the vaccine. Make sure you give a history of your past COVID-19 infection so that they can define the timelines. And also, if you have a medical disorder like diabetes, hypertension, kidney disease, HIV, you should take the vaccine as soon as possible because you're in high-risk category. And any adverse reactions, you should report to your doctor or to the reporting centers and pharmaceutical companies. And what you're not supposed to do, if you have tested positive for COVID infection, do not take the vaccine up to 60 to 90 days after the infection. Or even those that have received monoclonal antibodies as part of the treatment. Okay. It is also recommended to avoid switching brands. So once you got Covaxin, second one Covishield, no, don't do that. And also do not try to pre-medicate. Some people take fever medication or pain medication before going to get the vaccine. Try to avoid that. And don't stop wearing masks and practicing social distancing when getting vaccinated. And how do you prepare for side effects? Most of the side effects are mild. So you can, the common side effects being headache, body aches, fever, pain, and inflammation at the site of injection. Usually these are observed in 25 to 35 age bracket and more in females. So you take your Dolor, which is nothing but the paracetamol 650 milligram to treat the fever. Drink lots of fluids, get rest, and you may have some nausea. It will go away eventually. Any pain, redness, or swelling at the site of injection will resolve by itself. Or you can put an ice in the affected area. Sometimes you may vary. I have not seen so far. If you see any infection, then you have to address it and may need antibiotics at that point of time. I will end the topic with some memes which my daughter put. She did the slides for me, so I have to give credit for her. So I hope you all followed through. It's the end.
Wonderful explanation, ma'am. Any questions, ma'am? Any of you, if you have questions, you can put it in chat box or raise your hand. You'll be unmuted. You can ask directly. Ma'am, before students, anybody come up with their questions, I want to ask you one thing. Like, there is no particular correct treatment for this COVID, right?
Correct.
Like, then people, why taking steroids also is not good, but why doctors are prescribing steroids, ma'am? Is there any
that is to reduce the inflammation. Steroid is a known anti-inflammatory, very powerful anti-inflammatory.
Yeah.
So what happens, but why you should not take before 5 days is if you take before like the first 5 days, right?
No.
But steroid also suppresses
No, yeah, ma'am. Continue.
Steroid suppresses the immunity. So what are you doing when you're giving steroids in the first 5 days? You're suppressing immunity, right? So the inflammation is a lot more because steroid is an immune suppressant too, right?
Yes.
But it also helps in inflammation if it is given at the right time. After the entire lung got inflamed, then you give the steroids, then the steroids are going to work better. So
okay.
You cannot use before. That's why you have to use after 5 days. Yeah, a lot of people are doing because it's available over the in the pharmacy there. They're just buying it, but that's the wrong thing to do. Even in, it's very unfortunate. Even one of my friend died doing that.
So it's not good.
Not in the at least not in the first 3 days. Not in the first 3 days at least.
So is it not possible like without steroid treatment people get cured? Is there possibility?
Yes. Lot of them, the mild cases, not the moderate, the mild cases, nobody will need a steroid. Nobody.
Because the next question I have is death after taking these steroids.
Who had what? Sorry, repeat again.
No. Lot of deaths I've heard after taking steroids.
Exactly, because they are taking the steroid at an inappropriate time. That's what is the problem. They should not be taking within 5 days. No, it's not going to help. It's actually going to worsen the disease. Because once your immunity is more low, the inflammation is more high. You're not even giving your body to fight at all. So
there's a question, ma'am. Can people with drug allergy can take this vaccine?
Yes, use with caution. There are no drug reactions, but again, food allergies, you have to be careful. People with food allergies have had anaphylactic reactions, which is a severe allergic reaction. Drug allergies, not so much. If you are not so much interaction with the vaccines, no. Because it has no egg product or anything. So that's why. Should we go for a second dose?
Should we go for second dose? As people say it has many side effects and they are scared to take second dose. Is it?
Yes. The first dose, if they have experienced pain at the site, injection, fever. Some of them, if they have had a severe reaction, I would avoid, but moderate reaction, yes, I would go and take, because the first dose is giving, suppose it's giving 40% immunity. You need to reach to 78% as Covishield or Covaxin is giving, right? So for that second, you need the second dose. So if you're lucky enough, first dose itself will give you full immunity. But as per studies, what they have done, 2 doses will give optimum immunity. That's why try not to avoid it. Nothing will happen. It will be the same side effects.
Okay.
So
another question, ma'am. One of the student, what she want to know is, she got a COVID negative and took Covishield vaccine. So after 2 weeks, is it good to take another vaccine? Is her question.
She already took Covishield, right?
Yeah.
After getting COVID negative. Oh, she was COVID positive and then she became negative. Is that correct?
Yeah. Yes.
Oh, she got the COVID disease, became COVID negative, and then depends on when she got the COVID positive.
Okay.
COVID positive, you don't take COVID negative. COVID positive, you have to give 3 months time to take the vaccine. At least 2 to 3 months. With the COVID positive, not the negative. Negative I may have done my test 2 months later and I'll be negative. So I can take even the next day, not a problem. Right? When was the first positive is important one. Got it? Whoever has the question, I hope you understood. Rami Reddy, Geeta, I hope you got it, right?
Yeah. Why deaths are seen even when they are done with the 2 doses of vaccine is another question.
The deaths are seen because we don't know the underlying medical problems. They may have severe diabetes. With the steroids, what happens? Your blood sugars increase tremendously. So uncontrolled diabetes at that point of time, hypertension, already some immune problems, cancers. Don't know. It's really hard to say. In the real thing, I'd say it's unlucky if they don't have any medical problems and the vaccine is not helping. Don't know.
Ma'am, one more thing, like what I observed is from our neighbors, this is in last June, that family of 3, father is affected and till 5 or 6 days, he hasn't revealed. They have not revealed to anybody in the apartment. So, of course, they are even mother and daughter, wife and daughter are exposed to him. He has been affected with the COVID symptoms and all, and mother and daughter are absolutely fine. So, do you think their immune system is strong, or they didn't show any signs of COVID?
Yeah, they are fighting it out better. Probably they have, better immune. As you know, even if you see, right, how many are, like, if in India, the death rate seems high because, but in the billion population, only less than 1% are dying, if you really see that. So 95% are recovering very well.
Yes.
So they come into that 95% category.
Another question, like which vaccine do you recommend for aged people?
Aged people? Whatever is available at this point of time.
Better.
But I would go with Covaxin if it is available.
Okay.
Covaxin is my preference. Yeah.
Okay. So after vaccination, all the side effects indicates what, ma'am? Why side effects after vaccination, I think? Vidyashree is asking.
Why side effects? Your body is reacting, right? That's a sign of immunity, that the vaccine is working. Imagine you have a mosquito bite. Would you itch or not? Right?
Definitely.
So you're introducing something foreign to the body to react. So your body is reacting. So side effects in the process is acceptable.
There is
it's the way
another
the
question.
body is reacting. Yeah.
Yeah, definitely. Even this BCG also, when it is given to kids soon after their birth, definitely some children develop fever. It indicates
Correct.
vaccine is working in them.
Exactly. Yes.
Yeah, that's what I've been telling while teaching these students, but still they have doubt. They want confirmation from a doctor. Okay. So, did our body get immune if we witnessed corona? Will corona attack second time?
Generally, my answer is you will not get infected again. Very rare, very, very, very rare. Less than 3%, I think, have gone. They've hardly accountable cases have been reported. Very rare so far that had second infection. Usually with any virus, right? Like as you get chickenpox or measles, it's permanent immunity. Yes. Same thing should be the case for this. Yes. Only problem with corona is because the variant is changing. It's mutating. Because of the spike proteins. So when the mutation is happening, what's happening? The base coronavirus, whatever is there, is the same, right? Some of the genetic sequence is changing. So your body will still recognize the coronavirus. The variant may give you symptoms, you know. But again, once you got the coronavirus, they're highly unlikely that something will happen to you. In terms of mortality, meaning getting hospitalized, getting severe shortness of breath or dying is very, very, very rare.
Another student, Manasi, she wanted to have a clarity, like if after taking vaccine, if there are no side effects, does it mean maybe her view is vaccine
no,
working?
it's fine. It's a no, there are no side effects. It still is good. That means your immunity is good. I didn't get any side effects, so I was good. And I checked my immunity and I was immune. Yes, so it doesn't mean anything. Yeah. Okay.
Any more questions, ma? All your questions are cleared, I believe. We are undergoing second wave of COVID, but the COVID vaccine came under the first variant. That is the doubt.
That is correct. But as I said, the base coronavirus is the same. They do anticipate some of the variants and they make the vaccine, which they have done actually with Covaxin and Covishield. That's what the new studies are showing, that it is effective against the new strain, even the Delta strain actually. So nothing to worry. Get the vaccine. It's fine.
So why
base corona is the same. The coronavirus, the spikes are changing, but imagine the actual coronavirus protection you're getting. So
why post-COVID patients are affecting with black fungus?
Why what? Sorry.
Why post-COVID patients? Yeah.
Because post-COVID hospitalized, right? Not that are the ones that are at home. Or you're talking the ones even also at home? Little clarification, because hospitalized we can understand, and also post-COVID, even if they are at home, right, their immunity is down already, and if they have diabetes, any underlying medical problems that reduces their immunity, they are prone for fungal infections. That's why surrounding areas is very important, very, very important. You know, as you have seen, even in water, if you have a pot, if you have a, like you're growing plants, you see the fungus on top of it, right? Right?
Yes.
So same where it's all over. So any wetness can cause. So our lungs are completely wet all the time because of inflammation. So it can affect. Fungus can, you know, and you're inhaling the fungus through your nose, where does it go? Straight to your lungs. So
yes, definitely. So after taking second dose among 50 to 60 aged people, how long will be the side effects of vaccine?
How long? 3 to 5 days, maximum a week. Some people have had symptoms up to a week, but 99% 3 days.
Thanks a lot, ma'am. You have given a wonderful explanation, and I think all the doubts of our students and parents and faculty who are attending are cleared. Now I request Christina to propose formal vote of thanks. Christine, are you there?
One person asked what vaccine is recommended for 18 plus. Right now, both vaccines, Covishield or Covaxin, both are good.
Okay.
And steroid is an anti-inflammatory. It's like your ibuprofen, right? But much more stronger. And it can be used as an injection. Ibuprofen usually doesn't come as an injection, but this one can be injected or taken in inhalation, like the nebulizer, or even as an oral pill. Okay?
Okay, ma'am. Thank you. Christine, are you there?
Yes, ma'am.
Yeah.
A very good morning to one and all present here. I am Christina Joyce from BDCFS third year, and I am here to propose a vote of thanks on behalf of all the students and the entire fraternity of management here. First of all, I'd like to give my hearty vote of thanks to our most respected and distinguished guest speaker, Dr. Vijaya Nima ma'am, for today's lecture on treatment, prevention, and immunization against COVID-19 disease and what we need to know, which was very informative and interesting. I'm sure the knowledge that ma'am gave us will help us in our studies and future. The information about the immune system, different kind of vaccines that are being used like Covaxin, Covishield, Sputnik, Pfizer and BioNTech vaccine, Moderna vaccine, Johnson & Johnson vaccine, and the differences and the side effects and myths and facts about Covishield and Covaxin, which was very valuable. Ma'am also gave us a detailed explanation on mucormycosis, its risk and treatment, which was very informative. I once again thank Dr. Vijaya Nima ma'am for taking time out of her busy schedule for us. Thank you, ma'am. I would also like to thank our principal, Dr. J. Achyuta Devi ma'am, the HOD of the Department of Biotechnology, Dr. Nanda Devi ma'am, the program coordinator, Mrs. M. Nagrani ma'am, for organizing and conducting this lecture. I would also like to thank Dr. Vani ma'am from the Department of Botany for introducing our guest speaker to us. Last but not the least, I would like to thank all the students for attending and giving their undivided attention to the lecture. Thank you.
Thank you so much for giving the opportunity to be part of you.
Thank you very much, ma'am. Catch you up later. Yeah. I have so many things to ask. I'll be catching you up later. I won't leave you, ma'am.
Sure, no problem.
Thank you, ma'am. Thank you. And good night, ma'am. Now I can say.
Oh, thank you so much. Thank you.
Okay, ma'am.
Okay then. Bye.
Bye, ma'am. Bye.